Are you wondering how you can become a specialist in endodontics or root canals? Are you not sure if your current pathway through dental school will help you? Or are you just not sure how you're going to go through the process and what things you should be doing right now to becoming a board certified endodontist? Stay tuned as we talk to a doc who's going to share everything about his journey to becoming an endodontist. Let's go. Welcome to 32 Questions, 4 quadrants of questions. It's a video series where we ask questions that highlight the different dental specialties and focal areas within the dental profession. Why? To gain insight into life as a practicing dentist, or a healthcare professional, or a resident in training. So, let's get started. So, Doc, what's your name and where you're from?
Name is Randolph Scott. I am from Columbia, South Carolina.
Awesome, awesome. And what's your specialty?
Specialty is endodontics.
Now, how long have you been delivering care as an endodontist?
Endodontist, 16 years.
16. Wow.
Yep,
Okay.
yep, 16 years.
So before doing that, you went to undergrad. Where did you go to undergrad, and what was your major?
Major there. So I went to Morehouse College in Atlanta, Georgia, and Georgia Tech. They had a dual degree program there. So I was a math major and electrical engineer. So they
Oh,
had
wow.
a combined program there where you could do two bachelor degrees in 5 years.
Wow. Wow. So that sounds like a non-traditional route, at least for dental school, right?
Yeah, absolutely. Yeah,
Yeah.
absolutely.
I
So
and the
I
only
did
reason,
not,
huh?
yeah, I
Yeah.
did not know I was going to do dentistry when I first started off in college.
Same here. I'm guilty. I was an architect major, so I
Okay.
get it. I get
Yeah.
it. Where did you go to dental school?
I went to Mary Medical College, Nashville, Tennessee.
Now, in between Morehouse and Meharry, did you do a transitional year before
I did
dental school?
I did not. I just went
Oh,
right
okay.
out. Yeah, right
Gotcha.
in. Yeah.
Gotcha. So at Meharry, what would you think? What would you say was the thing that you liked the most about dental school, or the favorite part?
Specifically at Meharry, I mean, it was a smaller school size, compared to a lot of other dental schools. So you got to know the whole class. It was a, quiet campus. Um, it you pretty much, there's a lot. It was almost like it felt had like a family kind of feel to it. A lot of the upperclassmen when you first came in would kind of show you the ropes. So that was the best part about the school, is that it had an intimate setting to it.
What would you say is the least part, the least favorite part that you remember about dental school?
The least favorite part would probably be, and this is probably common amongst a lot of schools, is having to get your own patients. There are always a few
Mm,
that were in the dental school, but it's never enough to get your completion. So you found yourself having to get out and, go into the community and really market yourself. So
right,
that was a tough part, in addition to the didactic part of school.
right, right. So that part about, of course, didactics, but more or less for patient care.
Mhm.
Um, would you say that also was the hardest part about dental school, or just the least favorite part?
It was up there on the hardest part. I would say the volume of information you have to know is probably the hardest part. coming from my background of math and engineering, it was more so the concepts of having to understand what you were doing. It wasn't so much the volume of work or memorization that you had to have. So that was a transition for me, is just going from having to learn something that was tough conceptually to go into, something that's not as tough, in my opinion, learning the concepts of it, but just the volume of information was tough for me.
Yeah, yeah. On that first day of dental school, did you know at that time if you wanted to specialize or if there was a focus area that you wanted to concentrate on?
Not really. I would talk to some people, students and dentists that I knew, and I would hear both sides. So I kept it open, but I did not go into dental school knowing I was going to do endodontics or specialize at all. So I kept it open.
So 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 on the flip side, you didn't necessarily have a specialty that you were thinking about, but also was there something about dentistry that you were like, oh, I'm gonna learn the basics, but once I'm done with school, I don't want I do not want to do this anymore, this part of dentistry anymore.
I think as you go up in the ranks, or each year, you start to figure out what you like and don't like. First starting off, though, you have no idea. Unless you come from a dental background, like maybe you were an assistant or lab tech or had somebody in your family that was a dentist, you really don't know. You're just going off of what you hear people say. So I kept an open mind. I would listen to everything that people said, but I wanted to make my own decision about it as I went. So I didn't start to get that association of what I wanted to do until maybe the second or third year of dental school is when I started to really figure out that this is what I want to do.
Yeah. Yeah.
Yeah.
Oh, good. So we're going to transition now into our second quadrant, focus a little bit more on endo. So what about endo? And it probably happened, like you said, maybe during second year, you started seeing something about several specialties, but more specifically about endo. But what about endo that made you fall in love with it?
I would say it was definitely a teacher that we had. Dr. Hill was a really passionate teacher that we had in our second year that introduced us to endodontics for the first time. And I fell in love with just the science of it, and I enjoyed it. We actually had the preclinical instruction. I found it fascinating. So I was always looking for that. What specialty am I going to enjoy? If you're going to pick something to do as a field, you want to enjoy it. So that was the first cue that I wanted to do it.
Shout out to Dr. Hill
Yeah.
at Meharry. I don't know if he or she is still there, but
No, he's not.
I'm
He's
he's not
actually
there.
unfortunately passed away. Yeah.
Passed away. Okay. Well, still shout out to Dr. Hill for getting uh, helping you with that exposure and helping you with that interest into endo. So even though there are um, some traditional pathways into endo, some programs may be different. So how long was your endo training?
Well, the program I went to was 2 years. Traditionally, it can be 2 or 3 years. Usually, the 3 year programs have a master's included with it, where you do like a master's degree on a certain topic. My program did not have that.
And where was the school you went to?
I went to Tufts
Tufts.
in Boston.
Yep. Okay. Shout out to Tufts, endo. Um, so endo, what both coming from a perspective of learning and wanting to get into endo, and then once being an endo resident, you tend to have, maybe two different perspectives about the specialty. What do you think is the most unique part about endo, or what do you think is the thing that sets endo apart differently from many of us as GPs who do 80% of the endo, right? That's
Correct. That's
done.
correct. I think you're basically saying like as a specialty, what sets it apart from just doing it as a general practitioner? I would say you tend to get the more difficult cases, whether it's the actual case itself or the patient itself. You learn about endodontics more on, I would say, more on a molecular level, just how it interacts with how the dental pulp interacts with the body, the immune system, how medications are involved, uh, treating diseases. You just learn it's the same thing, but it's just you learn it at a deeper depth of information. So
And that deeper depth um, of the information that's learned to become board certified, but also be known as a specialist, um, again, sets you apart from dentists who are doing endo, right?
I would say that you learn what cases not to do, those kind of things. Sometimes when diagnosis is big, everybody that has dental pain is not necessarily endo related. I notice a lot of cases that referred are like that. We get a lot of referrals that, oh, this patient's in pain, and they automatically assume it's coming from the nerve of the tooth. So first of all, diagnosis is big. Learning, whether it's coming from neuropathic pain or musculature. There's various reasons that somebody can have pain in the oral facial region. And then just handling those cases, it's tough. Certain teeth are very difficult to treat. Learning how to use biomechanical materials, like bioceramics, not necessarily doing a full root canal on certain things. Uh, it's just, I would say more complex cases and learning how to manage them.
Why should, in your experience, why should someone consider endo? Like who is endo for? As those that are in dental school now,
Hmm.
or those that have maybe have been practicing and they're thinking they like doing and just want to be exclusive to root canal
Root canal.
therapies. Yeah.
Yeah.
So why should like who is endo for more specifically? Like what's the profile of a
Of
dentist
endodontics.
for an
Yeah,
endodont? Yeah.
I'm a firm believer that you should go into a field that kind of fits your personality, lifestyle. Most endodontists tend to be very detail oriented, persistent. You need to be that type of person where you're paying. We're dealing with millimeters here. Half a millimeter or 1 millimeter can make a difference. You have to be scientific minded. You want to stay on top of literature and sciences. That's a big part of our field is that, a lot of the advances that we had in our field have come from a lot of the research and studies and being able to incorporate that into a clinical practice. So that's the profile of the person.
Yeah. So let's flip it.
Okay.
Who is endo not for?
The exact opposite of that.
Is that
If
guy?
you don't like doing the same, it's not really the same thing over and over again, but anytime you specialize, you're going into a deeper dive into a particular field. Some people like going having the variety of doing different procedures and having different things come up throughout the day. With the endodontist, it's not so much the same thing over and over again because even within the specialty, there's a lot of diversity of procedures that we do. But if you're not the kind of person that likes to go into a really deep dive into this particular field, like I said, if you don't have that patience, really, really good manual dexterity, it's not for you.
Yeah, that's key. Um, and it reminds me of another wave that's really getting to the point where, we can't live without it. And
Mhm.
it's now starting to impact dentistry. It may influence not only how we treatment plan, but also how we approach some of those clinical encounters, looking for the best clinical outcomes, and that's AI too, right?
Hmm.
And I have a question related to that, but we'll get to it in a minute. But
Okay.
I think also to your point about not wanting to, an individual who's not willing to do a deep dive, there's an opportunity for individuals with AI to be able to do a deep dive, but also to explore more about the intricate pieces and puzzles in millimeters or less than millimeters that endo presents itself. It just made me think of that deep dive and how AI now is allowing us to give us some more information that also the patients or the people that we're serving, it helps them understand what we do, how we're doing it, and why certain treatment modalities are being recommended. So a quick aside, but let me get back.
Oh yeah,
And,
absolutely.
but I brought it up because I'm interested to hear later on how AI, or what's the thought related to AI in the specialty as well. So, but let's get back to more about the you as an endodontist. Stereotypes. Are there any stereotypes about an endodontist?
If there are, I'm not aware of any. You may be able to run those by me. I'm not aware of any right offhand. Some specialties do have that stereotype, but I'm not aware of any for endo. And if you have any, I would like to hear them.
No, I don't
Okay.
know of any.
Yeah.
I don't know of any. I mean, outside of,
Yeah.
we as dentists being very type A,
Right.
I don't know if that's a stereotype as much as it is a fact.
Right. It is. Yeah,
Right, right.
absolutely. Yeah.
So
Yeah. And I
outside of
would
that,
say that's probably a good thing for endo. Like I was saying before, if you're that type of person that likes to be, persistent and tenacious almost, um, it's a stereotype that's true, especially if you're
yeah,
going to be a good endodontist.
absolutely. Especially when you're
Yeah.
trying to use science and clinical approaches to, solve the problem, right?
Right. Right.
And many times solving the problem may require 3 or 6 months follow-ups
Right.
just to see if the clinical modalities are resolving some of the issues that the tooth or the nerve or something else is causing as well, right? So that persistence, being patient
Right.
as well.
Even
So it's
within the
not,
even within the procedure too, there's cases where you're doing a root canal and it may not be that recipe that you have. You run into a problem where there's a ledge or you break a file. How do you change your treatment modalities like you were saying? Um, some patient may not be able to have certain procedure done, due to their medical history or something. You have to be able to think on top of your feet, be creative on how you do treatment. So
yeah,
it goes hand in hand with the personality type for sure.
yeah, yeah. Hey everyone, it's Dr. Darwin. Just want to take a quick break from this episode and hope that you are enjoying it. First thing I want to ask is, did you know that a large majority of the individuals like you who watch these episodes are not subscribed to the channel, to the YouTube channel? Nevertheless, we want to say thank you for watching and continuing to share these videos and episodes with others. Next, I want to say is subscribe. Yes, please hit the subscribe button so that you get these notifications each time these episodes are released. Last is I wanted to connect with those of you who are seeking to become an advanced dentist and specialist. And I invite you to our next event called the Get Into Dental Residency Challenge. This is a special 4-day event that will give you direct access to the mistakes that you want to avoid when you're applying to residency programs, and also the 8 steps that you also want to avoid so that you do not have an unsuccessful application submission. The information that we will be covering over the those 4 days will be some of the tips and strategies that I teach in my one-on-one and group coaching trainings with clients who are continually and successfully being matched into and selected into high-profile residency programs here in North America. So, if you're pursuing or aspiring to get into dental residency this application cycle, this challenge is for you. Check out the link below to receive more details and join the challenge. And also, I would encourage you to enroll in the challenge via the VIP experience. The VIP experience gives you actually access to a 1-hour Q&A session every day of the challenge before we actually get started with the challenge. And it guarantees me to answer your specific questions that you and other VIP experience members have on a daily basis. So I'll see you in the Get Into Dental Residency Challenge, and let's get back to this episode. Let's dive in now to this third area related to a typical day and cases that you've are continuing to work on throughout these last 16 years.
Hmm.
So what's based on where you are right now, and it may be different than maybe some practice modalities that you've been in over the last 16 years or previous to where you are right now. But typically, what's your average day like, or your typical day like, if there is such a thing? I don't know if you have certain days where, you have block scheduling, Monday, Tuesday, Wednesday, and then referrals on a certain day. Like, how is your day set up?
Yeah, so I'm part of a group practice. I work out of several different offices. So we're kind of in the western part of the state of Massachusetts. And my typical day starts at 8 in the morning, is when I see my first patient. And I typically finish up at 4 o'clock. And I take lunch from 1 to 2. And I usually book treatment patients on the hour. From 8 to 4, excluding the lunch hour, unless there's emergencies. And I see a consultation along the side of that.
So based on that, my math is not mathing right now because I haven't had all my
Yeah,
coffee here. But
yeah.
so typically, how many patients a day is that? That's about 5 to 6 patients a day.
Yeah, treatment patients, it can be 5 to 7 treatment patients. Total patients, maybe 10 to 14, if you include the evaluations or consultations.
Yeah, 10, 14 for
Mhm.
evaluations. Gotcha. Give us a procedure that maybe you've worked on or maybe you're currently working on that's been one of the hardest or most challenging, even for you as a board eligible, board certified endodontist. What's been the most challenging procedure? And just kind of share, if you can share some details about it.
Yeah, I would say the most challenging procedure, and most of the endodontists will probably agree, is just lower molar or any type of mandibular surgery, just because of the positioning of the patient, the different structures that are around that can be a problem if you get too close to them, like the nerve damage or anything like that. So those are the toughest procedures to do, is lower molar mandibular surgeries.
And then what's in the practice where you are right now in the offices
Hmm.
where you're on? It sounds like it's like a group practice with multiple locations. What
Yes.
would you say is the most routine? Are you getting only or mostly molar root canals? Are you getting a combination of both? Are you doing uh, evaluations for potential fractured teeth and then maybe placing implants? Because we do know that that's something that's being taught in endo schools now.
It is. The most common procedure is root canal therapy on molars. We do get a combination of surgery and molar, and I'm sorry, and root canal therapy. But the most common being the root canal procedure, root canal therapy. We don't place implants. I was not trained in my residency how to place implants, so I don't do that. I usually do refer out for that if needed.
Gotcha. Gotcha.
Yeah.
Okay. What's give what about a case? What's been one of the most memorable cases um that you've
That
completed?
I think there's been a lot, so it's hard to pick from. One of the most memorable cases, though, that I've seen, and it's very uncommon. I want to say a couple years out of residency, there was a young patient that had a extraoral fistula. So when she first came into the office, she had a draining um, fistula on the outside of her lower chin, and her parents were saying that she had been, to a dermatologist many years, and they were trying to treat it with, antibiotics and laser treatment, and they had no idea for the longest that it was related to a dental infection. So we were able to go in, diagnose it, treat, do the root canal over a couple visits, and it resolved the issue that she was dealing with. It was becoming like a self-esteem problem because she had this draining fistula that was there, and she would always try to cover it up. And this is before COVID. So, they she wasn't able to wear a mask or anything like that. So that was actually kind of a satisfying case to treat and see the result of that, heal. So that's probably one of the most memorable cases I've had.
Yeah, and it's probably and it probably was memorable for the dermatologist too, in the
Absolutely.
sense in the sense that you know they have most physicians have little knowledge or have any level of collaboration or interdisciplinary or interprofessional education and contact with us as oral health physicians to the point where it's right there.
Yeah. You just
Right.
don't think of it too. And
Yeah.
I would give them credit for that because when you look at that, when I saw that lesion at first, you don't jump to a tooth as being the etiology immediately. Because it looked like, some type of dermatological problem. So I can understand that, but once you took an X-ray, it was evident, you could see it. That it was, and it's rare. I haven't seen any case like that since, something that we saw
Yeah.
in the textbook. So that was a very memorable case.
Yeah. And again, just to, make the point of why oral health matters and how it's part of overall health and how it also is very routinely, unfortunately, and routinely missed, right? How
Yeah.
we as dentists and oral health providers, we understand, not only the mouth, but everything else that's part of the mouth and how the
Right.
mouth is connected to all different parts of the body and even
Absolutely.
parts of the body that are not connected to the mouth, we have to understand. Whereas on the flip side,
Mhm.
um, and maybe this is, again, this is all part of why it's important that all health professionals are working and learning and have curriculums that you know cross intentionally or cross covering one another. And oral health should be part of the curriculum for med school, for pharm, for
Mhm.
nurses, right? For reasons just like this, because unfortunately, when there is a referral, they probably will not refer to the right person or not think to refer to the right person. In this
Right.
case, Derm saying, you know what, it's around here somewhere. Let me
Right.
maybe refer to a head and neck person or ENT
Right.
or a
And I can't remember
dentist.
the details, right? I can't remember the details of that case. But eventually she did get to a dentist. And I think it was after they realized that it was not, the case was not being resolved. So they started to think about other things. But
Yeah.
that goes back to your point. I mean, that was one thing I noticed in dental schools. I thought it was an artificial separation of dentistry and medicine. That was one thing I noticed is that at Meharry, we actually took like a lot of the basic science classes with the med students. And it's to me as you start to learn dentistry and how you can't separate these things from medicine. It just happens to be a specialty and with subspecialties of the body. It's no different from ophthalmology and nephrology and anything else that's there. It just happens to be the teeth. And
Absolutely.
the way that the educational system has structured it is separate from medicine, and it shouldn't be.
Yeah, it should be because in reality it really is not,
Hmm.
right? Oral health is a specialty of medicine,
Right.
right? Whether it's uh full body medicine, physical medicine, it's health. I mean, period. It's health. So, great segue, great story about that most memorable case, and just more emphasis for those of you who are listening and watching why oral health is important and why it matters and how it's not separated from the body and it influences many different things. So, um, just keep that in mind as we continue to move forward in your journeys. What would you say has been the toughest part of your position as an endodontist or your role as an oral health provider? What's been the toughest part that you've maybe have encountered, whether it's patient related, profession related?
Um, that's a tough question. I would just say, dentistry in general, it can be mentally demanding. When you come in and you're seeing all these patients, you have to be on top of it. You have to pay attention to the details of, this patient. You can't just look at it like it. That was something I noticed in dental school that can be a tough transition going from like preclinical to clinical, where you're working on this mannequin and you have an extracted tooth in your hand and you're just focused about the procedure. So, going from that to working on patients, you have to bring the whole picture in there. The patient's anxiety, their medication, their past trauma, and bringing that in and coming up with a treatment plan and executing it. And so that can be tough to do consistently well on every single patient that you're doing throughout your practice. So that's the hardest thing, and still keeping a balance, work-life balance. So. Just learning how to manage that is the hardest thing.
Yeah.
Yeah.
On the flip side, you did mention this earlier about a memorable case and how what you shared with the patient and her family and how that was a transformative experience for them
Hmm.
related to level of confidence. So w- outside of that, what do you feel has been the most rewarding part about what you do as an endodontist?
Oh, taking people out of pain. Every now and then you get that patient, and it can be very frequent where you have this patient that's telling you they cannot function. You ask them what their pain level is on the 1 to 10 scale, and they tell you 12. And within seconds, you can go into a room and have them pain free just from anesthesia, get rid of the problem, and allow them to save their tooth. And you're changing their life. From not from like a life or death situation, but somebody's literally suffering. So that's something that can be very gratifying.
Yeah, that instant relief, right?
Right, right,
Instant relief. So much so that it's so rewarding for you and for them
right,
that they get confused and realize, okay, just because you out of pain don't mean we the procedure is done.
right.
Miss
Exactly.
Jones, we still got two more steps we need you to come back to. I know you out of pain and that was your chief complaint, but
Yeah,
you got to come back. You got to come back
right.
to get that taken care of. Speaking of pain,
Hmm.
have you had any instances or cases where the fear of going to the dentist, more specifically, where the patient has to get numb, right? They have to
Hmm.
get the needle, so to speak.
Right.
Have you had any cases or treatments where that fear from the patient was so severe that you had to collaborate and maybe work with maybe getting that person sedated, whether it's with a dental anesthesiologist or someone else who maybe is trained or someone that you brought into the office to do some type of conscious sedation?
We've had some cases like that that approach that level. I don't personally have anybody that we bring into the office to do sedation like that, which would be a great idea to do. It's tough to find that in this area. A lot, but it's very common. People come in with a lot of dental anxiety that's either passed on from their family members, past experiences, or just general anxiety about somebody being in that intimate space. So a lot of times we try to just reassure them, that the procedure is going to be fine once they get numb, and we verify that it should be good. I do prescribe like oral sedatives, to help people with that, but I don't routinely use like an anesthesiologist.
Yeah. Okay. Moving on to lifestyle and fun, before we get into some bonus, and for those of you that are listening, watching, keep listening all the way to the end. We got some good stuff coming up. Lifestyle, fun. Let's talk a little bit. We talked about how your work day is,
Hmm.
a typical work week. So what I didn't remember was how many days a week that was, and
Week.
how that
Yeah.
equates to the number of hours. So how many hours do you work per week, would you say?
I'm busy. 5 days a week, 40 hours a week.
Okay. And that, would you say, does that include taking call or addressing patients' needs after hours as well?
Well, fortunately, I'm in a group practice, so I get to rotate that responsibility with my partner. So we rotate that every once every 4 weeks. So somebody will take call for that starting on a Friday and cover that whole week, recover like weekends and after hours.
Okay. So
So
what about
not
you?
all,
As Oh, go
yeah.
ahead. Go ahead.
Go ahead. No, go ahead.
And I was going to say, as far as after hours, how
Mhm.
does that impact the hours of time that you sleep? How many hours do you sleep usually?
I get a full night's sleep. I usually get at least 8 hours of sleep. The good thing about endodontics, or I say dentistry as a whole, which is why well, that's one of the reasons I selected that over medicine, is that it's a pretty good lifestyle balance. There's not a lot of involvement after hours, especially in this practice. So usually, when I'm done for the day, I get to kind of just leave all that at the office.
Yeah, and I think that's one of the reasons, one of the things that continues to make dentistry so very much popular
Hmm.
with a lot of people, is that lifestyle balance, and how you're able to structure how you're providing care and treating and helping people. Um, and then also how you can help yourself have fun and enjoy life, right?
Right.
So are you a morning or night person, would you say?
I am more of a night person.
Really?
Yes.
I was gonna say more, I was gonna say morning. Okay.
Yeah, I'm more of a night person. I tend to be more focused at night. Um, but I have learned to be more of a morning person. So, on the weekdays, I get my cup of coffee like you started off earlier, and this helps kind of focus me throughout the day. But
Yeah,
yeah, yeah.
yeah. Um, Chart write up. I know that can be a big bugaboo or challenge for some people, especially if you're seeing anywhere from 10 to 14 people a day,
Yeah.
including evaluations. How long does it usually write up, for you to write up charts, and what's the system you guys are using to make that a little bit more efficient?
So I haven't, a lot of my colleagues are starting to get into like AI and stuff like that. I haven't incorporated that into the practice yet, but I do have templates, and that helps cut down a lot because that's the good thing about what, doing endodontics is that a lot of the cases that we do are similar. So I
Hmm.
can set up a template, fill in different parameters that change, and chart write up per patient after doing it for so long doesn't take that long.
Yeah,
5 to 10 minutes for a standard treatment. If I'm bringing CBCT scans in, it may take a little bit longer because you have to analyze it, document that in the chart. But for the most part, we're just plugging in parameters that change. Yeah.
gotcha. So let's talk about some favorite things. What's your favorite
Mm.
color?
Blue.
Blue. Oh,
Blue's my
Tufts. A
favorite
little bit,
color.
little bit of tufts there. A little
Yeah.
bit of tufts there.
Yeah.
All right. Favorite food or drink or beverage?
That's a tough one too, but I would have to say my go-to, and my wife put me onto this in DR is a fried red snapper and a Presidente.
Presidente.
Uh,
Presidente. Okay. Favorite place to visit or vacation? Is it DR? Sounds like that's one of the places you guys go to,
that's
or
one
that's
of the
on your
places
list.
we like to go. Yeah. I would say Greece or the Amalfi Coast in Italy.
As
Breathtaking
in,
stuff there.
as in a place that's going to be on that's on your list to go to, or you guys have been already?
We've been there before, and I would like to go
Okay.
back. Yeah.
Yeah, I hear it's beautiful, man.
Santorini and Amalfi Coast right there, on the top of the list.
So, outside of traveling, what else is one of your favorite things to do when you're not in the office?
Um, I have two main hobbies now. One I've had since college, table tennis. That's like my cardio and everything that I do outside. I played that starting in college, and I've kept it up. I play like on a rec level after work, and I'm into bonsai trees as well. That's like
Bonsai
like
trees.
yeah, that's kind of like my relaxation or meditation. Uh,
That's your uswa. What uwa, not uwa. I can't even say it. Uswa, not uswa. What am I trying to say?
yeah.
Um, Oswa? I don't know. Somebody put it in the chat, please. I'm trying to figure out. I can't remember. Uswa, Oswa. I can't think of it. Like you just release, like meditation, like right? That's cool.
Yeah.
All right, so guys, listen. Thanks for staying on. Now we're getting to the bonus section. The bonus section. So, if you didn't already have a pen and paper or your iPad ready, this would be the section that you definitely want to write down and refer back to it. So, Dot,
Yeah.
dealing with patients every day, 40 hours a week, anywhere from on average 5 to 7 or 14, up to 14 patients a day. What are some of the common instructions that you are or tips that you are constantly giving to your patients? Common instruction tips, health advice, or health advice that you find
Mhm.
yourself constantly sharing to individuals that you're helping with their oral health care.
I would say, a couple things. Try to maintain dental visits, cleanings, x-rays, and everything like that. Because a lot of patients only think that, pain or symptoms are you know, or reasons to go into the dentist. And I tell them, sometimes you can have a problem going on that is asymptomatic, and you can save a lot of time and finances by going in routinely to have that done. Minimizing sugar. Being an endodontist, we know that a lot of the disease process that happens with the tooth happens from cavities, and a lot of that's diet related. Um, Parafunctional habits like, using your teeth to open certain things, crack teeth, grinding, that kind of thing. If you find yourself grinding, wear a night guard, work on like stress reduction, trying to get the better, uh, I don't know, trying to relieve like stress in your life can help a lot, because that's what the most common thing you see other than caries exposures of the nerve is cracked teeth. You see that a lot. So those are the tips.
Gotcha, gotcha. Now we need some tips for aspiring endodontists, right? And many of them are
Mhm.
listening, using this information to kind of help them paint the overall picture of the lifestyle of an endodontist, what it means to train as an endodontist, what a typical day is like once they are finished through residency. For those that are listening and they have decided or getting very close to deciding that this is their pathway, what are 3 or 4 things or more if you have them that they must do right now on their journey to becoming a board certified endodontist who first must get into residency?
Trying to get into school. I would just say, just and this is with everything, just be persistent with it. If you have that in your mind, that's what you want to do. Don't accept no for an answer. It just if one way that you're attempting to accomplish a goal doesn't appear to work out, just find a new pathway. And it's not always easy to do that, but just have that kind of mindset. Um, Also stay on top of science. Anybody in the field of dentistry is a scientist. So, a lot of what we do is research based. So you want to make sure that your approach to dentistry, once you become an endodontist, or whatever you're doing is always based off of science. You're treating patients, so you want to always be compassionate. That was something that, I want to say a lot of people that come into your practice are extremely anxious or nervous, and they manifest that in different ways. Sometimes people are like disrespectful and everything, or rude, and a lot of times it's because they're anxious or they have a lot of anxiety. So you always maintain that compassionate side and realize that that's your first goal is to help people out and staying on top of ethics. You know, anytime you're in healthcare, ethics have to be at the top of the list of what you're doing. And it's the bond between trust of the doctor and the patient. So those are the tips I have.
And those are great tips. Those are great tips, especially um, for those that have now achieved the level of becoming, that have now become an endodontist. What about those that are at dental school right now and they're getting ready to put their applications together, or they think they're getting ready to put their application together? Going
Mhm.
back to the things that you did that you felt was very successful for you in your journey, and you're applying to getting into Tufts endo. What are some things that those individuals who are at that stage, what should they be doing?
You always want to maintain high scholarship, make sure your grades are good. Outside of that being said, and that's evident, is you want to know what you're getting into. So you want to shadow an endodontist. Because I can't tell you how many people, go into a field that's in general that they don't love. You can pick anything to do. You want to enjoy it. It's a compounding type of decision that you make, because if you make the bad decision of having a career that you don't love, it tends to trickle outside of your life, and you want to pick something that you enjoy, because if you're going to be doing this all day, every day, and you enjoy it, the rest of your life usually is pretty favorable. So shadowing endodontist, make sure that's what you want to do. Get into some research as well. That always helps out and strengthens your resume. Um, those are the tips I can come right offhand though.
Now, when you say get into research, it, and whether it was something you did as a student or
Hmm.
maybe either an undergrad, you may have done something on
Yeah.
your pre-dental track, or even as a dental student at Meharry. When you say do research, what does that mean? Because we get this question all the time about, well, if I don't do research, does that look negatively on my candidacy? So when you say do research, I mean, and there's many
Hmm.
different components of doing research, right? Um, explain what you feel is appropriate related to the term do research. What does that mean? What does that all entail?
So research can be, I would say, if you're trying to get into a specialty program, a lot of them are looking for like scientific research, even if it's not specific to dentistry or endodontics. They want to know that you get that type of methodology where you're learning how research is done. Because if you go back into the interview, we were talking about it before, one of the advice I said was to stay on top of the science. A lot of these fields, or just medicine in general, is science-based, science-driven. And if you can demonstrate to a program that you have a scientific mind and you understand that scientific process, then they're more willing to take you as a candidate because they say, okay, this person has at least has a basis of a scientific foundation. So I would say research in any type of field, it's better if it's specific to, the field that you're trying to go into, but science in general. You can get into a research program. I was fortunate enough at Morehouse School of Medicine, I was able to get into a research program with NASA. It had nothing to do with teeth at all, but it gave me a background. I was able to, to conduct the actual lab work, look at, how manuscripts are written and just see that overall environment. So
Yeah,
that
that's
I think,
helpful.
yeah, it definitely helps.
That's helpful. So again, those of you listening, watching, it's not that you have to be the lead author in a publication or research project. You could be a contributor. You could be someone that's working in the lab. You could be someone that's helping with the manuscript. Any and all aspects of research you want to be involved with, that counts as doing research, right? Being in that environment and demonstrating that you understand the scientific process overall. So, doing research, shadowing offices, making sure you're maintaining good grades, right? High GPA. Anything else that you can think about that you did as a dental student applying to endo programs that you felt was that gave you an advantage or helped you stand out as a candidate applying to endo?
Networking is another thing. Um, Talk to as many people as you can in the field. It helps you get an idea of just the field that you're going into and talking to the people that are in it, you absorb some of their traits, just by seeing how they think and their thought process, how they went about doing things. The more people you talk to, you hear different pathways. You say, oh, that may work for me, or I want to do it that way. So networking is good.
And where would you say the best place for students to network? How do they network or something similar?
There-
Give us an example about something that maybe you did.
yeah. So I didn't do this personally, but I just went to the last AAE meeting in Boston, and there's a lot of students are on top of that in dental school, and they decided to go to a meeting to sign up for the endodontic meeting as a student. So they were able to go in and see the conference, go to some of the lectures. They got to meet some of the endodontists out there, fellow other students that they're in. So they're just networking within that field. So that's one example of how to do it. The other one, like I said, is shadowing local endodontists. You get to meet somebody right there in that area. Um, those are different ways you can network. Dental school, talking to the professors there, program directors, clinical instructors.
Yeah,
Yeah.
all very key. So those of you listening and watching, see, we told you there is very high value and importance of going to the meetings, being in the environment with the people that you want to call colleague or endo colleague or pedo colleague or a facial pain colleague, right? You have to be in the places where those people that you aspire to be are already located. So networking, doing research, shadowing offices, having good grades, right? And then also being ethical, being compassionate with people and also demonstrating that compassion, being a scientist, right? Being understanding how to do the methodology and know the science behind the things that you aspire to be as a board certified endodontist, and being persistent, right? Now listen, everybody can get into to endo. You can. Unfortunately, not everybody at the same time. So that means not everybody's gonna get in on the first time. But if you say no and say, well, you know what, I'm not gonna apply again, well then you've just taken yourself out of the game, right? So part of the process is getting to having some no's so that you can get to yes. To get to yes. And Doc, yes, thank you for all this information. What's the best way for people to reach out to you if they have some more questions or just want to connect with you as well?
I'll give my email address is so my initials, H is in Hubert, and then R is in Randolph, S is in Scott, I at gmail.com.
We put that right up there. Check that out. Reach out to Dr. Scott and connect with him as part of your networking exercise en route to becoming an endodontist. Thanks so much, Doc. Guys, we thank you for watching. And if you want to get some more information, go to this next episode. Go to the next episode right now. Go.